name is Julia Harris, and I studied human biology as a major with a minor in global health. Human biology was a major in the Department of Anthropology. Immediately after graduation, I moved to Brazil to work at the National School of Public Health, and then I went to medical school, which is why now I'm an OB/GYN doctor in Philadelphia doing my residency. Well, it gave me the starting point, the jumping off point to be working in global health initially. And since my first job opportunity, my first thing that I worked in after college was in global health, I was able to see really quickly that the connections I'd made as an undergrad, not just when I went abroad through the program, but also I went, my undergrad thesis was written by doing research in South Africa, which I had gotten to through the global health program. So the connections I made and the research I was able to do and the confidence that I was able to build by having those experiences abroad basically allowed me to take my first job outside of the US. And since then, I've kind of been on this pathway to be working always with global health people. So. I had one mentee because I lost my other mentee early on. She was very busy with stuff. So, and mostly we worked, we emailed each other, and we didn't have a ton of infrastructure in terms of the topics that we covered, but I kind of would look at what we had to accomplish overall in the whole time period and make sure that we hit upon it through our kind of natural conversation. So we started with, what does global health mean to you? Why are you studying this? How do you think it's going to, affect your career path? What do you see yourself doing? What kind of work do you like to do? And then we talked about how to build that career path academically. So we talked about courses to take, internships, and basically what kind of experiences while she's at Northwestern she could have, and then building towards what kind of career she wants, and kind of how a career, like her career choice, she's interested in medicine, how she can house that in a life of global health. I hope, and I think she did get out of it, an understanding of what kinds of experiences in global health can be valuable for her in terms of her long-term career, and how they're not necessarily what she might think, and how there's a lot of sometimes failures that you have to have and awkward experiences you have to have going abroad in order to understand how you could ever work abroad long term. Because I think a lot of our conversations focus on having realistic goals and focusing on what she wants to accomplish in the big picture, because when she initially wants to go abroad, she just wants to help people. So I think I was able to kind of bring her towards more small, immediate, focused goals that would allow her to help people as a doctor if she gets to that point. You have to listen with your eyes when you're abroad, because you might learn a language that someone speaks, but unless you really understand the context, which is how they use the language, how they talk, and relationships between people, unless you understand the complete context, you're never gonna really understand what people are telling you. And as a doctor, it's really important to understand the unspoken. So I think I learned that as a student being abroad, because you're just so lost and you don't understand anything. So if you learn that, I think as a doctor, it's actually very helpful. There is one by Emerson, and I can't remember it exactly, but it talks about how leave behind everything that happened today, all of the failures and all of the triumphs, because you're going to start a new day tomorrow, which is really important in residency because it is filled with a lot of failure. But day to day, I think getting up and being willing to start over, I've come to a point where I actually now can look behind me and say I've accomplished a lot. But in the day to day, I think I'm only able to do that because in the day to day, I'm able to get over the ups and downs.